Hello medicos, in this video I will be going to discuss about the pulmonary function test. The pulmonary function tests are used for the medical diagnosis of the lungs disorders. The most of the lung disorders are diagnosed by the pulmonary function test or PFT. So let's start the pulmonary function test. We are starting from the basic. Okay, first we are starting with the ventilation or ventilatory disorders. In this we are talking about obstructive lung disease, restrictive lung disease. So what is obstructive lung disease? Basically it is problem with the airway. It's a problem with the airway. And restrictive lung disease is the problem with the parenchyma. See here, in obstructive disease the problem with the airway, and in the restrictive disease there is the problem with the parenchyma. So what happened with the parenchyma? See here, this is the difference between parenchyma. Here is parenchyma having the elastic activity. Here's the parenchyma which is increase in number, increase in density or increase in number, which occur in fibrosis, extra collagen deposition. And in restrictive diseases, the airway is normal but getting stiff due to the increase in parenchyma. Increase in parenchyma, the airway becomes stiff. Okay, now they are being the less compliant, and due to that there is an inward pulling than the outward pushing. So there will be increase in inward pulling and decreasing outward pushing. So the lung becomes small. Okay, the lung becomes small in the restrictive diseases. Okay, coming to the obstructive diseases. Before understanding the obstructive diseases, we are brief about some diseases of obstructive disease like chronic bronchitis or emphysema. So the chronic bronchitis occur in the chronic smokers. What happened? The smoker inhaled the soot particles, which contain carbon, which is irritative to the airway. So it irritates the airway and produce the secretion in response to it. So the secretion is persistent. Okay, the secretion is persistent, which causes blockage of the airway. Then the secretion is continued. So body adapt and hyperplasia of the salivary gland occur. The increase in the salivary glands secretion and metaplasia, which will lead to the metaplasia. Hyperplasia will lead to the metaplasia of the goblet cells, which will lead to the more secretion. So more secretion will be there, so more obstruction will be there. Okay, the diagnostic criteria for the chronic bronchitis is the cough with the expectoration for 3 months for 2 consecutive years. Okay, this is the diagnostic criteria for chronic bronchitis. See here, excessive secretion in the airway which causes obstruction. Okay, the interesting thing is the obstruction occur in the airway. There is no effect on inspiration. The air is going in, but it having difficulty in the expiration. See here, this is alveoli. Okay, air is coming, here is obstruction, exchange occur, oxygen goes to the blood vessels and the CO2 comes here, but there is CO2 is not able to come out. So there is trapping of air inside, which causes hyperinflation of alveoli. So in obstructive diseases there will be air trapping, which will lead to the hyperinflation, which will lead to the increase in the size of lung. Okay, so we know that in our chest there are 2 diameters, AP diameter and transverse diameter. Okay, transverse diameter. In this case, AP diameter is equal to transverse diameter occur. Okay, anterior posterior diameter is equal to transverse diameter. So the chest will become the barrel shaped chest. Done. Now coming to the emphysema. In chronic smoker, it is also occurring in chronic smoker. The soot particles deposited on the alveolar parenchyma, which will lead to the activation of neutrophils, and macrophages. They engulf the soot particles and they regurgitate the protease elastase enzyme. So elastase causes degradation of elastic tissue, damage to the elastic tissue. So the airway become the narrower and the space become the larger. Okay, and the outward pushing is more than the inward pulling. So the chest become large and the compliance is increased. The space inside the lung is increased, so compliance is increased, and the elasticity is decreased. Why? Because of elastase tissue. But this mechanism is counterbalanced by alpha-1 antitrypsin, but it is absent in the emphysema. So the chest wall become the barrel-shaped chest, which is the characteristic of emphysema. Okay, now we see obstructive lung diseases are the problem with the airway, and restrictive diseases having problem with the parenchyma. So here it is inward pulling is more than outward pushing. Here is the outward pushing is more than the inward pushing. Okay, in obstructive diseases there is an increase in the compliance, increase in compliance. Here decrease in the compliance. Okay, now coming to the small exercise, the graph which is of lung volume versus pressure. This is a normal lung. So this is the lung volume is increased. Okay, the lung volume is increased and the pressure is little. Pressure is same for both. Okay, the lung volume is increased. Where the lung volume is increased? In the hyperinflation of alveoli, which occur in the obstructive. So this graph is of obstructive disease, lung disease. And here the lung volume is decreased. Okay, then this graph is for restrictive lung disease. Okay, coming to the main PFTs, actual PFTs. So here, revision again. Obstructive diseases, expiration is more difficult here. We already see air get trapped inside, so lung become larger or the chest is become barrel shaped. What are the obstructive diseases? Emphysema, chronic bronchitis, asthma. Remember, asthma is a reversible thing, reversible disease. Okay, coming to the PFTs, this is a normal pulmonary function chart. See here, this is a wave chart, shows the spirometric reading, shows this. This is a tidal volume. Okay, and this is the inspiratory volume. This is the vital capacity complete. This is the expiratory volume. This is the residual volume, and this is a functional residual capacity. Now coming to the abnormal graph. This graph is of obstructive lung disease. Okay, then what are the characteristics of obstructive lung disease here? There is increase in total lung capacity, increase in compliance, decrease in stiffness, and decrease in vital capacity. Okay, and increase in residual volume. These are the characteristics of obstructive lung disease on the spirometry. Now this graph is showing the restrictive lung disease. Okay, here we see the total lung capacity is decreased, compliance is decreased, stiffness is increased, we already saw, vital capacity is decreased, residual volume is also decreased. This is a graph of restrictive lung disease. Okay, now coming with the expiratory volume. In expiratory volume, we plot one graph. On y-axis I am having forced expiratory volume, on x-axis I am having time. Okay, in this we calculate the ratio of FEV1 and FVC. FEV1, it is an forced expiratory volume at 1 second, and FVC is forced vital capacity. The forced expiratory volume, how we calculate it? When you expire at first second, when you expire air at first second, how much air you expired or expelled, that is a FEV1. Okay, the ratio is important here. The normal ratio is 80%. Okay, the normal ratio is 80%. FEV1 by FVC is 80%. So see here, what is, suppose this is 5 liter, this is a 4 liter. Okay, what is FEV1 here? FEV1 is 4 liter. At first second it is a 4 liter. 4. Now, what is FVC here? 5 liter. So it is an 0.8%. So it is an 80%. Okay, now coming to the obstructive diseases chart. In obstructive diseases, there is problem in expiration, right? So the expelled air at 1 second, it is 2 liter. So calculate again, FEV1 by FVC. FEV1 is 2 liter and FVC is 4 liter. Then how many? 2 ones are 2, 2 to the 4, that is 50%, which is less than 80%. So any ratio less than 80% suggestive of it is an obstructive lung disease. Now coming to restrictive. In restrictive, there is short lung, there is decrease in vital capacity, both forced vital capacity and decrease FEV1 both. So the ratio is not changed much. So see here, FVC is 2 liter, okay, and it is 1.6. It is approximately equal to 80 only. Okay, 80%, equal to 80%. So the ratio is not changed. In restrictive lung disease, the ratio is not changed much because there is decreasing both sides. FVC is also decreased and FEV1 is also decreased. So the ratio is not changed much. Now coming to the spirometric finding of expiratory flow rate with time. Okay, this is a graph, same as we saw earlier. This is the forced vital capacity. This is total lung capacity, TLC. Okay, this is TLC, total lung capacity. Okay, same what we plot. This is a peak expiratory flow rate, means at the time you are breathing and expiring the same amount of air, that is at peak of your expiration, that is peak expiratory flow rate. So calculate again. We are calculating the same ratio only, FEV1 by FVC. FVC is here 5 liter, FEV1 at 1 second it is 4 liter, it is 80%. Same. Now coming to restrictive disease, same, we are calculating the FEV1 by FVC. What is the FEV1? FEV1 is 2 liter at 1 second, 2 liter, and FVC is 2.25. Okay, it is approximately, see here, it is approximately 80. No change. In obstructive diseases, same, we are calculating the FEV1 by FVC. FEV1 by FVC. At FEV1 there is 2 liter and FVC is 7 minus 3, 4 liter. 1 by 2, that is 50%, that is less than 80%. So it is an obstructive disease. Now coming to some graphs, see here, this is a normal graph, expiration and inspiration. During expiration we follow the positive pressure. During expiration we are having the positive pressure, and during the inspiration we have negative intrathoracic pressure. See here, during expiration it's like this. This is peak expiratory flow rate, and during inspiration this one. Now this purple graph, where we see the purple graph, this purple graph we are seeing in the obstruction of the extrapulmonary region. Extrapulmonary region, for example trachea. If the foreign body obstruct in the trachea, then this type of graph will be seen, purple graph. Okay, now coming to the restrictive disease, we know that restrictive disease, the lung is already small, the lung is small, so all the capacities, the total lung capacity is decreased, residual volume decrease, and what, vital capacity decrease. So we found this graph. Okay, the lung volume is decreased, residual volume is also decreased, and you show this graph. This is a graph for restrictive disease. Now coming to the obstructive disease. In obstructive disease we know that what happened, increase in total lung capacity, decrease in vital capacity, increasing residual volume, okay, and increase in compliance. Okay, total lung capacity is increased, see here, and the residual volume is also increased, but we know that we are having problem in the expiration. See here, initially we are expiring well, then after that the graph becomes stiff. It shows that we are having problem in the expiration. Inspiration we don't have any problem, so the graph of inspiration is normal only. Okay, that's all about the PFTs. Thank you.